Whenever you are calling the patient by name, just use the surname. Don't call it by first name. First name, if you know the patient, and then if you create a rapport, and then you can call it by first name. Call him by first name. And if you forget the name in between, just call him sir or madam. Yeah,
That's the same.
don't look at the task again, wasting time. Okay, this is my GMC number. I understood the task. Shall I proceed? Thank you. Mr. Chef
Clark.
Mr. Clark. Hello, Mr. Clark. I'm Dr. Mohan, one of the doctors in this department. I'm here to examine your legs. I heard that you have some pain in your legs. Is that right? Yes. I know which leg is it.
Right.
Okay. For the purpose of examination, you need to undress below the waist, and you can stay in your briefs, and I'll ensure adequate privacy and ask my examiner to kindly do that. Is that okay? Yes. I'll be verbalizing my findings to the examiner, so kindly bear with me, Mr. Clark.
Okay.
On inspection, I couldn't appreciate any shininess on the skin, any loss of hair, any pigmentation, any obvious ulcers. I couldn't appreciate any discharge, any redness, any scars, sinuses or swellings. Could you please bend your knee joint for me, both the knee joints? I couldn't appreciate any redness, any scar, any swelling, any sinus, any ulcer. The posterior aspect of the leg as well. Could you please extend both your legs? Thank you. Could you please fan your toes? Thank you. I couldn't appreciate any fungal infection between the digits. I couldn't appreciate any ulcers on the pressure areas. Can you please lift your legs?
Yes.
I couldn't appreciate any ulcers over the back of the legs. Couldn't appreciate the same on the opposite limb as well. Now I'll be gently touching you, Mr. Clark, for the purpose of examination. If there is any discomfort at any point, kindly let me know. Is that okay?
Okay.
I couldn't appreciate any localized rise in temperature. No, I'm really sorry about that. Are you okay?
Yes.
Shall I continue?
Yes.
I couldn't appreciate any tenderness on both the legs on the anterior aspect. Could you please bend your legs for me? Both the legs. I couldn't appreciate any localized rise in temperature on the posterior aspect of both the legs. Now I'll be touching a bit deep. Is that okay? I couldn't appreciate any localized tenderness on the posterior aspect of the leg. Could you please extend both the legs? Thank you. Now I'll be pressing your big toe a bit. If there is any discomfort, let me know.
4 seconds.
Capillary filling test is abnormal on the left side of the leg. Ideally, I'll do the Burgess test as well. Now I'll be raising your left leg. Tell me if there is any discomfort, okay? I'll look for blanching in the foot.
It's pale.
Mr. Vishal? Mr. Clark, I'll be putting your foot beneath the couch. Tell me if there is any discomfort, okay? I'll look for reflushing. Okay. Burgess test is positive in my patient in the left leg. Thank you, Mr. Thank you, Mr. Clark. Now I'll be listening. I'll be feeling for your pulse. Is that okay? I could appreciate the femoral pulse. Could you please bend your both the knees? I could appreciate the popliteal pulse. Could appreciate the dorsalis pedis, medial malleolus. I could appreciate the posterior tibial artery. Could appreciate the posterior tibial artery in both the legs. Now I'm going to listening to your tummy. Is that okay?
Femoral bruise.
I could not appreciate any femoral vein. Thank you, Mr. Clark. You have been very cooperative. Now you can dress up. Ideally, I'll complete my examination by measuring the antebrachial pressure index and also doing a Doppler. If the examiner asks about the diagnosis, tell that he's having peripheral vascular disease. Could be atherosclerosis, eye, anything.
Such as
Okay.